Hello, this is Dr. Emmanuel. I work here at the teaching hospital in Benin. When the COVID-19 pandemic first hit in China, I remember thinking to myself, is this another flu epidemic? And then news came out from Wuhan, thousands were getting infected and hundreds were dying. And then as the weeks went by, it ramped up to thousands who were going under the scourge, and unfortunately many were dying. And then China went into lockdown and then spread to the contiguous nations of Asia and then to Europe. And then I began to pray. As soon as it hit Europe, and because of the influx of foreign nationals and Nigerian citizens coming from Europe, North America later on into Nigeria, that this was going to become a pandemic. And then the information came out that some of us had to volunteer to work at the isolation wards that have been set up in my hospital and across different capital cities in Nigeria. And my basic instinct was to volunteer. I'm instinctually drawn to conflict. I love to mitigate disaster when it comes. That's part of my emergency room physician component. As a family physician, I'm trained to see cold, unventilated cases. But as one specializing in emergency medicine, I'm drawn to the spontaneity of conflicts, I like to call it. So when this opportunity came, I caught an opportunity, I thought to volunteer. But of course, I need to confer with my wife, I need to talk with family, because the implications of, first of all, when a person is come in contact with a patient who has a contagion, the protocol is to quarantine yourself for the maximum number of days of that infectious entity. Now, we're used to Lassa, so for Lassa, the incubation period is typically 7 to 21 days. So we tell persons who have been exposed, healthcare workers, doctors, nurses, and other clinical staff to self-quarantine with them down of lights, twice daily temperature monitoring for 21 days. For COVID-19, what we do know so far, which is still evolving, is that the incubation period is between 7 and 14 days, or 4 and 14 days for most part. So we say you're going to quarantine for about 14 days. But when you're working in the isolation ward, it means you'll be on perpetual quarantine up until the last patient is discharged, which could be at the tail end of this scourge, which nobody knows when it will end, and up to 14 days thereafter. So I need to have the conversation. And my wife, the doctor, a product of CMDA, we've both been trained to work as soldiers and as servants. As soldiers, we march on in times of conflict. As servants, we put ourselves on the line in order to cater for our patients. It wasn't really a difficult conversation, but it was one that was still spiced with what if, what happens, what couldn't, because let's face it, health professionals are dying from this pandemic around the world. So whereas historically I'm one who doesn't really have the fear quotient, but when it comes to family, you have to think twice. What happens if you suddenly drop in the midst of the war? No person is invincible, come to think of it. So there was that concern that was in the background. The real challenge was the logistics of self-quarantining. That means I had to be isolated in a home, away from family and friends. I couldn't touch kitchen utensils. I couldn't sit on the couch. I couldn't use the TV remote control. I couldn't, if I mistakenly touch surfaces, I have to disinfect immediately. When I came home, and that's what happens now, I would have to go into the shower straight up, wash, and then stay in the room. Food being brought to the room, tray has to be dropped at the door, go take food and eat. It's like we're living the experience, which I've never had, of being a leper or an outcast in your own home. You can't touch your family and friends, you can't hold your spouse, you can't kiss or do other things, you can't even, of course, now understanding the fact that there's a scourge in town, you can't shake hands, you can't hug people. But now coming home, being a doctor who's attending to this patient, now I can't reach my family members physically, I can visit my parents, I can't even be at home with family. And typically when you're faced with so much emotionally challenging situations out there at work, and you have been pummeled, battered even by seeing the challenge your patients face on a day-to-day basis in the hospital, when you go home, you have emotional support. That's where we have recourse to. But now home itself, was becoming more like a hospital. And that's what it's been for this times, this few days into a week. I've been on quarantine and working in isolation ward. But I appreciate deeply my wife, Dr. Mrs. Laura Nino Wako Duare. I thank God that I met her through CMD, and thank God for what she has become. I thank God really because it's clear that training does help. The Bible says in Ephesians 6 that put on the whole armor of God that you might be able to withstand in the evil day. It was a training we received at Christian Medical Dental Association. Beyond our medical school training, in medical school you're trained to save lives. In CMD you're trained to not just save lives but to save souls, to care for the whole man, spirit, soul and body. And that training has become useful. It has built our faith resilience, it has built our emotional latitude to be able to withstand the challenge that comes with being in the front line, isolating oneself or quarantining oneself from family and friends. It's a challenge. It's still going on. I still have patients right here in the isolation ward. I don't know how long this course would last per se, so I'm saying I'll do it to summer. That could be 3 months from now, and then whatever the last date of the discharge of the patient, I have to add 14 days to that before I can return back to normal life. I can hardly wait to hug my family. I can hardly wait to cuddle and kiss my family and friends and just say thank God this is all over. But I'm going to wait. So far it's been good, so far it's been challenging, but it's also been a blessing. It's an opportunity to learn how to connect without having to physically engage. That's something that we're going to learn, how to bond more without even having to speak a word, without even having to see each other. That's something I'm learning at family level, and also learning interfacing with friends over social media. I'm also learning how to bond more with colleagues. There's nothing as deep as the solidarity in misery, as I call it. When you all face with trouble, I'm getting closer to my nurses, and it's a multidisciplinary team, so I'm getting closer to the nurses. I'm chatting with the nurses, and I always do that, or I often do that, but now it's deeper, chatting with the nurses and the health assistants, the porters, the cleaners, the technicians who handle the oxygen cylinders, who handle the pipelines, even the plumbers who are currently fixing a plumbing leak at our facility here. It's been a blessing because these are now my immediate family. It's so amazing how crisis can show us what truly matters. Simple things that we take for granted every day. David said, I lay myself to sleep. God woke me up in the morning. Now I thank God for each blessed day. For my patients, for my colleagues, for my family, for my friends. After this, I am positive. I am fully persuaded that we'll come out stronger. Now may God of peace sanctify you wholly, your spirit, soul and body. And may He present you and preserve you perfect unto the perfect day. Now faithful is He who has called us, who also will fulfill it. God bless you.